Hello, everyone, and welcome. My name is Narelle Doan, and I'm the Director of Marketing for Viking Pure Solutions. And we are proud to invite you to join us today for our panel discussion about improving health and safety in schools. And we're going to touch on topics such as childhood asthma and indoor air quality and the effects of cleaning chemicals and other issues on the health and safety of our school environments. So I'm very excited to introduce you to our panelists today. Sarah, do you want to kick us off with the introductions?
Sure. Thanks so much for including me, Narelle. Appreciate the opportunity to be part of this panel today. My name is Sarah Porter. I'm the Vice President of External Affairs at Healthy Schools Campaign. Healthy Schools Campaign is a nonprofit organization. We are based in Chicago, and we do work all across the country. And we operate on the premise that healthy kids are better learners. We all know this to be true. So HSC takes a look at all the different factors that go into creating a safe and supportive, healthy school environment. Our focus is primarily K-12 public school districts across the country. We have a very particular focus on low-income, underserved, underprivileged communities. Our interest is making sure that all students everywhere have access to a healthy school environment where they can learn and thrive. So we look at school food, access to physical activity, the kinds of cleaning chemicals that are being used. We work on expansion of access to mental and behavioral health services and many, many different things. So excited to be here today talking about this important topic. Thanks.
Awesome. We're glad to have you. Peter, how about you?
Thank you, Narelle, and thank you to Viking Pure for having me on this panel. My hearts and prayers go out to those in Florida who are being devastated as we speak. I'm the CEO and founder of Smart Air Defense. A company was started in New Rochelle, New York, the East Coast epicenter of the pandemic. Over the last 17 years, I've been in the spray foam insulation world, supplying contractors who insulate homes, commercial buildings, and schools. And spray foam insulation has always led to better indoor air quality because of its ability to reduce natural ventilation, resulting in less outdoor pollution coming indoors. It's about building tight buildings that are properly ventilated using mechanical filtration. But filtration before the pandemic had a whole different meaning than filtration after the pandemic. And recognize this in 2020, we surrounded ourselves with the best mechanical engineers, microbiologists, doctors, and HVAC specialists to find the most sustainable and best performing solutions for schools.
Wonderful. Thank you. Beth, how about you?
Yeah, hi, everybody. My name is Beth Lambert. I'm the founder and executive director of Documenting Hope, or a 501c3 nonprofit organization. And our focus is on educating parents and practitioners about what we call the new childhood epidemics, so these escalating rates of autism, ADHD, asthma, allergies, autoimmune diseases, and more. And our focus is on identifying the root causes of these conditions, largely environmentally driven, and providing healing solutions for the families that are impacted. So looking at things from, again, root cause functional medicine, integrative holistic type approach, and also using this lens of total load, looking at how the many, many factors of modern living are contributing to the escalating rates of chronic conditions in kids.
Wow. Yeah, important stuff for sure. And Josh?
Hi, everyone. My name is Josh Schwartz. I'm the president of Viking Pure Solutions. Appreciate everyone taking the time to participate in VIEW. Our company is on a mission to remove toxic and harsh traditional cleaning and disinfecting solutions from the school environment and others. What we do is we manufacture a commercial grade piece of equipment called an electrolyzed water generator that gets installed on site at a school, and through a patented process produces two unique liquid solutions, a disinfectant and a cleaner that are both Green Seal certified and non-toxic, making it a much safer use for facility staff and to the exposure of students and teachers.
Awesome. Well, thank you to our attendees for joining us today. And before we get into the panel discussion, I just wanted to let you know we welcome any questions. We're expecting today's panel discussion to go for about 40 minutes and leaving 5 to 10 minutes at the end for questions. Feel free to put those in the chat or in the question area, which is on the right-hand side of your screen, the icon menu, the circle with the question mark in the middle. That's where you put them. And so without further ado, just to kind of set the stage a little bit, about 4.5 million children in the United States have asthma, which is about 1 in every 30 children in a typical classroom. Asthma is the most common chronic disease in children, and it's the leading cause of most missed school days. Sarah, we're going to start with you with the question. The Healthy Schools campaign has focused on the rising rates of childhood asthma since its early days. And what are some of the ways that school environments have historically led to increased asthma symptoms in children, or at least not helped to alleviate them?
So many things. It's an important question, and one that really prompts us to kind of understand what we're doing, not only in our sort of day-to-day operations in schools, but also as a country, as a society, as a community, how we're prioritizing the health of students while they're at school. So on that note, I would say one of the first things is that public schools in the US have never really been funded the way that they need to be funded to be properly maintained. That's across the board, in the US. And, even despite some of the special funding that was made available during COVID, that doesn't do anything to kind of really address the state that schools were in prior to that. To give you an example, in Chicago, the average age of Chicago Public Schools has about 600 or so schools. The average age of school buildings in Chicago is over 80 years old. And so while, you're sort of dealing with buildings of all kinds of different conditions, there just isn't the funding to renovate or rebuild. And in some cases really maintain them the way that they need to be in order to make sure that they are as safe and healthy as possible. And so you're challenging the facilities team with this, incredible task to figure out how to make sure that there's the right ventilation, that that there's a pest management program that, is dealing, with pests in a way that isn't bringing more toxic chemicals into the space. Pest management, I would say, is one big area that traditionally has been a thing that can really introduce harmful things into the space for students and staff. Chemicals of all kind, cleaning in particular, cleaning, sanitizing, and disinfecting. All of that, I think, it goes into sort of this bucket of, the need for more resources, more education. And over time, Healthy Schools campaign has been working on these issues. And I would say, looking back, we see an incredible trend in progress. There's so much that's different now that there was 20 years ago, with sort of the openness to exploring different technologies, the openness to really transitioning towards safer, less toxic chemicals, the openness towards a fully integrated pest management system. So much great stuff going on, but really, our starting point was many, many different factors that were going into contributing to that sort of potentially very harmful environment for students and staff. One really specific example I'll give you that still just drives me nuts is the kind of thing where we have, staffing shortages and not quite enough support for everything that we need. And then we see classroom supply lists, for example, where teachers are asking for disinfecting wipes to be sent in by parents. And those wipes may not be in alignment with whatever the district has decided about their purchasing, for safe chemicals. And then those wipes, even though they very clearly say, keep out of the reach of children, are often put in the hands of kids to help clean their desks and stuff. And I think that's a commonplace thing. And part of what we really work on is education to help make sure that all the adults in the spaces are really reading those labels, understanding what that exposure can do, and making sure that we're making better, more responsible choices for the support of the kids in the space and the adults too. One or two other things that come up, I would mention bus idling has been a big one that, again, we see like this trend and definite improvement, but for a long time with something that was happening all over the place, where you have a whole line of buses idling right outside a building, and that air is coming directly into that space, creating headaches, triggering asthma, so many things. And then the other thing I would mention is just, again, going back to funding and resources, not having school nurses in every building all the time. Nurses play such an important role in connecting the dots between what's happening, what kind of visits they're getting from students at what time of day, what are the potential environmental factors at play right now that might be creating a situation, and then helping make sure that we're looking at that and creating solutions for that. So I would say a lot of different reasons that this has been happening over time, a lot of incredible work underway, and still more to go.
Absolutely, for sure. I'd completely forgotten about the issue of like buses idling. And I would assume it's even worse during the winter when they're running heaters and stuff, or that's why the bus is on. Ugh.
Yes, and a lot of movement towards electric buses now too. So
Yeah.
There's and a lot of special grant funding for that. So there are things out there. There's a lot happening that's really exciting and positive, but definitely more work to be done.
Yes, long way to go. Beth, based off of your efforts with the nonprofit Epidemic Answers and the work of the Documenting Hope Project, can you set the stage for us a little bit and explain why childhood asthma is such a serious issue that school leaders should address? I know I talked about some numbers early on, but why is this chronic issue so important for us to pay attention to?
Well, childhood asthma is one of several chronic health and developmental conditions that are skyrocketing in the pediatric population. So, when you're looking at, depending on your locality, 1 in 8 kids or 1 in 1 in 5 kids, some urban schools have asthma rates that high. You're talking about hospitalizations, the cost of hospitalizations. You're talking about, potentially life-threatening issues for some of these children, but it goes beyond asthma. A lot of times asthma is comorbid with obesity, or it might be comorbid with life-threatening food allergies, autoimmune diseases. So asthma is a chronic inflammatory condition, and we are seeing a whole epidemic of chronic inflammatory conditions in our kids. And so when you think of asthma, you think automatically of air quality. And the air quality affects not just the lungs, but it affects the whole body, right? So if you're seeing kids who have been diagnosed with asthma, and all of the environmental factors that are contributing to that are the same environmental factors that are contributing to other chronic health conditions in kids. So the ADHD, for instance, that is a function of too many environmental assaults or stressors on these kids over a developmental timeline. So, asthma is the tip of the iceberg. The peanut allergies in every classroom and every lunch table, just the tip of the iceberg. So what we do at our organization is we take the view of it as the total load of environmental health stressors that are a function of living in the modern world that is creating this situation for our kids. So that perspective is important for seeing the solution too. So if we know that these children are developing these conditions because the chemicals are too great, because of the processed foods that they're eating, because of the disruptions to the microbiome from too many antibiotics, it's a multifactorial problem. But that means that the solutions are available to us by removing as many of those stressors from these kids as possible. So that might mean taking the chemicals out of their environment. That might mean taking the chemicals out of their food. It might mean spending more time in nature with, fresh air. It's really about doing everything we can to reduce the number of environmental and modern living health stressors on our kids, and increasing the health supports, the nutritious foods, the movement, and there's so much we can do. That's the optimistic part of this. Yes, we have a massive epidemic in our hands, but there's so many small incremental steps that can be taken. All the things that Sarah was talking about that are in a school environment, from the cleaning chemicals to the pest management to what mold, for instance, that kids might be exposed to in these old buildings. Those are things we can remediate. Those are things that we can take action on. So that's the optimistic, other side of this epidemic that we're facing, is that there's a whole lot we can do. There's a whole lot that's actionable.
That's a really good point. It's overwhelming at times to think about the work that needs to be done, but like just taking each individual step as you can to improve. We got to do what we can.
Mm-hmm.
Peter, let's talk more about indoor air quality, because I know that's kind of your sector. What are some of the ways that poor indoor air quality in schools can contribute to aggravated asthma symptoms or respiratory problems in children? I know we've talked about the buses, we've talked about the chemicals and everything, but if you could speak from the
so I'd like to start off with a statement that was given by Michelle Hurt. She's a master in public health, a PhD, and director of New York State School Environmental Health Program. She was asked, where does the poor air quality come from in schools? And it's a great statement that really touches on what Sarah and Beth had said, and it adds some more. The entire building is considered when discussing air quality. Contaminants, chemicals, dust particles, odors contribute to poor air quality. Contaminants come from outdoor sources such as vehicle exhaust, industrial emissions, construction activities, wildfire smoke, and pollen. Contaminants could also come from indoor sources such as cleaning supplies, carpets, cooking, pests, and renovations and building repairs. Building systems may also affect air quality. Classrooms need to get enough fresh air and exhaust stale air, which we'll talk about later, and maintain appropriate temperatures and humidity, and must address water damage and the signs of mold if mold appears. And so, when we talk about when you breathe in small particles in polluted air, it can irritate your lungs. People with asthma are at greater risk from breathing in small particles and irritating gases, and they can irritate the airways and make asthma worse. Anyone can feel effects of air pollution, but people with asthma are in much greater risk. And so that, going back to where are the sources, how do we reduce those things? What technologies, what mechanical ventilation systems can we have in place, which we'll get to later on, that could reduce those risks?
Thank you for that. Josh, we've talked a little bit about clean chemicals so far, but it's often one of the more overlooked contributors to poor indoor air quality in schools, specifically with regard to fumes and VOCs. What is the role of cleaning chemicals in creating a healthy learning environment for our students?
Yes, thanks for the question, Norel. I mean, I think first, listening to everyone who came, before me, it's evident there's a lot of different issues we're all trying to tackle, in schools to make these, safer, environments, obviously for the students, staff, facilities workers. And, there's not one answer to solve all of these issues, but it's great. We're all kind of attacking it from a different, manner, because there's all these different, vectors of penetration and, issues. And, it's great that Beth touched on, chemicals as being one environmental factor that, we can try to, remove or improve, the safety profile of what's being used in these schools. It's obviously critical that we're properly cleaning and disinfecting our schools. We know that, these are areas of, widespread potential spread of illness and sickness, especially with the amount of hours that students and teachers and, administrators and facility workers are spending in these environments. And I think that, in schools and other types of facilities, we've just accepted the traditional cleaning and disinfecting products are needed, even if they're extremely top safety warnings. We've ignored all these because we've been accustomed to these harsh smells of bleach and quats and ammonias, and we feel that we've cleaned if we're smelling, these toxic chemicals, even though those are, fumes and odors are being emitted, or just chemicals, that we're all, breathing in. Unfortunately, these, traditional chemicals also leave all types of, residues on surfaces. They create biofilms, which are just, breeding grounds for superbugs and, stronger pathogens, to grow. Unfortunately, there's now been long-term studies that have come out. If you're a housekeeping or facilities worker using traditional cleaning and disinfecting products, it's the equivalent of smoking a pack of cigarettes a day over the long term. And it just highlights that, these traditional products that we're used to using in schools and other types of facilities are emitting all types of, chemicals, odors, causing, breathing issues. So, we've seen in schools that we visited before they've switched to, Viking Pure, a host of different, issues directly related to, the safety and chemical characterization of traditional cleaning products. So high levels of asthma, allergies, skin irritations, nausea, headaches, lightheadedness, vertigo, and stomach issues, especially in, cafeterias and food areas that are preparing food to serve to, students and staff. So chemicals are being directly linked to all of these different health issues, which are all obviously causing discomfort and illness, but also inhibiting the ability of the students to learn and teachers to teach and facilities workers to do their jobs, because they're causing illness, they're resulting in sick days, and they're just creating an environment that isn't ideal for learning, and is just one more thing that we should all be able to take out of the environment in terms of distractions and issues, because obviously teaching in a school is hard enough, learning is difficult for most students. So we should be doing everything we can to improve that environmental factor. And fortunately at Viking Pure, we're working with schools around the country, providing our technology, installing our machines on site that are producing all natural cleaning and disinfecting solutions that are only made from water, salt, and electricity, with no other additives, surfactants, fragrances, that are leaving schools looking and smelling better, but most importantly, keeping students and staff safer by removing these typical harsh toxic chemicals.
Yeah, as we say, clean does not have a smell, or it shouldn't. Beth, how are Epidemic Answers and the Documenting Hope Project working to rethink our approach to children's health and chronic conditions like asthma, and these issues that overall reduce their quality of life? And kind of follow-up question to that, what are some of the practical strategies that school leaders and parents can also implement to ensure school environments are safer and better for children's well-being?
Well, one of the things that I think has been a barrier to us reversing this epidemic in our kids is this idea that if your child gets a diagnosis, whether it's asthma, life-threatening food allergy, ADHD, whatever it is, we go immediately to genetics and we think, well, is this in my family? Is this something that is baked into our genes? That's the notion of genetic determinism, that somehow all things related to health are found in the genes. Well, genes are important. But what we're finding in the last 30 years, because of the way that humans are living in the modern industrial world, is so different from the way that humans have lived previously, and these escalating rates of all these kinds of chronic conditions, we are now understanding how little genes actually play, and how big a role environmental factors play. So we have to shift the way we're thinking about health in general and move out of this idea that like, oh, we're just stuck, I have bad genes because I have this diagnosis, and into instead, well, what am I doing every single day that might be precipitating this condition? You kind of have to look at people's health history, and this can be multi-generational too. There's an epigenetic thing where toxins that your great grandfather was exposed to may have implications for how your body processes toxins today, as just one example. So I think we have to shift our mindset around, it's out of my hands, it's in the genes, to actually, there's a lot we can do here. And so it's a reframe, right? And so that's why we talk about this total load model, because if we start thinking about all the many, many, many variables that we interface with every single day, and try to make the best choices that we have available to us on a moment by moment basis, that's going to inevitably lead to better health outcomes. So what can we do that's practical? I think one of the most potent things like an individual can do is become a label reader. Is like when, instead of just going through, to Target or wherever you buy your regular everyday products for your home, instead of just doing the things you always do, pick up that bottle, whatever it is, whether it's something you're putting on your skin or it's something you're putting into your body as food. You read the label, and you want to use the guideline of, I'm going to choose whatever is the most natural, has the fewest ingredients. And as you're talking about like salt and water, you can get more basic than that in terms of ingredients, but that's the guiding principle, right? It's overwhelming. I've heard parents say to me before, like, I don't have a PhD in chemistry. I don't know if that chemical in the shampoo is safe or not. So you let that be your guide. If you're like, I don't know what the chemical is, put that back on the shelf, right? And do you know what shea butter is? Do you know what coconut oil is? Do you know what salt and water are? Like, those are the ingredients you can feel safe with. So I think that's actually just one of the most empowering things that we as individuals can do, is just be label readers. If you're buying products, and in all things that you do things that are as close to nature as possible, and close to what my grandparents did. So were my grandparents up on devices all night long, late into the night, messing with my circadian rhythm? Nope. So let's go back to the way our grandparents lived, or great grandparents even, with more in rhythm with nature. And that's across all things, like the things that we do, how much time we spend outside, how much time we spend in community. That might be what kinds of products we use, but it's really about just leaning into whatever is more natural is going to support health in a much better way.
I feel like with so many things these days too, we are lucky to have more options. I feel like, sure, go back to what our grandparents were doing as far as like not being on our phones, because phones didn't exist, or phones existed, but not smartphones, but then with all of these different products, it's not like we're just stuck with Pine Sol and like the bleach. We have so many more options like Viking Pure, and even with skincare products too, where you can find and access readily these products that have natural ingredients and have ingredients that you can pronounce and identify, and don't have to look up and wonder if they're cancer causing or harmful in other ways.
Exactly.
Sarah, what are some of the wellness policies that Healthy Schools Campaign has recommended through policies and programs, or seen used in schools to effectively improve student outcomes and address issues like childhood asthma and areas that are harmful for children?
So as I mentioned earlier, Healthy Schools Campaign takes a very holistic approach. We're trying to look at all the things that go into impacting that school environment. So along with really trying to combat the rate of childhood asthma in school children, we've also looked at a number of other things and really focused on like, what are the solutions? What are the environmental things? What are those habits? What are we putting into our bodies? What are all the things happening in school? And so healthy school food has been part of our core to our work since the beginning of our organization as well. Really similar to what Beth mentioned, the same sort of guidelines apply there, looking at like, what are the things that are going into that really processed food that tends to be served at schools. Again, this goes back to funding too, right? Because the reason for that is that the lack of funding for school meals means that those sort of longer shelf life, more processed ingredients end up in those school meals. But what is that doing to the health of our children across the board? And so really promoting healthy, less processed meals is something that we've been working on for a very long time, both in Chicago and Illinois and across the country. So that's been a big part of our work. We also do a lot of work around promoting outdoor spaces for learning and play, both from the perspective of getting outside and enjoying, that stronger connection with nature, and also from the physical activity standpoint. And also just because kids need to move and kids need to change things up a bit. And so we do a lot of work around making sure that schools have spaces outside that are really well set up for important learning, whether that's native gardens and edible gardens and outdoor classroom spaces, but also making sure that there's place to play and run around, and that there's that very intentional sort of connection of curriculum and being outside. We've also worked on policies and practices around sort of building maintenance, construction guidelines, like if there is an opportunity where new schools are being built, like what does that look like from the beginning to make sure that it's set up? If there's other work happening, how do we make sure that like health and wellness is a top priority when considering those types of renovations? But the big piece of it, I would say, at least especially connected to asthma, is really looking at the day-to-day operations. Focusing on really promoting green cleaning is something we've been doing since the beginning of our organization. And more recently, we expanded and launched a program called Healthy Green Schools and Colleges, which is a blueprint for school facility directors to really make sure that they are fully committed to health and sustainability in their day-to-day practices, both on the custodial side and the maintenance side. And within that program, there is a standard for managing a healthy, sustainable facilities program. And so it walks through all these different criteria that folks at home can use as well. So if you're trying to figure out what types of cleaning chemicals to buy or what not to buy, that standard, has all kinds of great information that really say, look for this, but, or avoid these things. Disinfectants is a great example where there's a very specific list of active ingredients to avoid. No matter what, do not buy these things. You don't need them, and they're much more toxic and much more harmful, and there are better alternatives. So I think that that program in particular is really doing a lot to support school facility directors across the country in making sure that their product selections, their training, their day-to-day operations are really set up to support the health of the students and the staff who are there using them day in and day out, year after year. And one thing too, Neural, going back to something you said, the importance of the availability of more and better options is something that's so important at Healthy Schools Campaign, especially around healthy green schools and colleges. We work with our partners in the industry. Our goal is to really increase the demand for healthier, safer products and tools and equipment for use in schools. And that goes hand in hand with that sort of availability of more and better products and tools, and at a competitive price that schools can purchase them. And when we look at the world of what was available 20 years ago compared to what's available now, it's remarkable the options that are out there that schools can choose from in order to make sure that they're prioritizing health and safety at school. So really, really important. I would definitely recommend folks to take a look at the standard. It's on our website with a lot of great information.
Awesome. Thank you. Yeah. Before we get into the last couple questions, just a reminder for our attendees that we are accepting questions, and feel free to put those in the chat or in the comment section. Peter, let's talk about some indoor air quality technology. What are some of the most effective ones that have been proven by third parties? I know when you and I were talking before, third-party verification of these systems and also products is one of the more important kind of things that you touch on. What are some technologies that have been proven to reduce asthma symptoms, and are there any commonly used technologies that don't help?
Thanks, Carol. So first off, unfortunately, because we're talking about the public schools, as Sarah mentioned, in Chicago, over 600 buildings that are 80 years and older, we have to start from the very basics, right? Before we get to the exciting technologies that can really do some amazing stuff, the basics have to be covered. And the basic is mechanical ventilation, right? So we still have today thousands of classrooms that have nothing but, for example, steam and windows. That's completely unacceptable, right? And we all know that. And even the superintendents and all the facilities directors, we all feel the same way. The problem, the challenge is that these old, very, very old schools, some of them are historic buildings, are the cost to retrofit them using conventional HVAC systems is astronomical. Astronomical. I'll give you an example. In the Boston Public Schools, they had 5 buildings they selected. They had a grant for $15 million, thinking that the $15 million would cover it. That's already a lot, $15 million, right? It turned out it was actually $70 million. When they got closer to it, it was $70 million to retrofit 5 school buildings, right? Take another one, Fairfield Public Schools. They just approved for 3 buildings, $39.1 million to retrofit. That's the conventional way of doing things. Fortunately, through the engineers that we work very closely with, we have a different design that actually costs a fraction of that. For example, in Fairfield, it would have cost $39 million. For us, it would have been somewhere around $6 to $8 million to retrofit the same buildings. That's a big difference, and something that is going to be heard in the next couple of years, the design that we have. It's a very simple approach. We vetted it through William Bonfleth, the chair of the ASHRAE 241 committee, the founder and CEO of the Building Science Corporation. These are top-notch people that are brilliant in their field. And we're very excited about that, because we're not not only is the cost a fraction, but the ventilation, we're not just meeting minimum ventilation. We're blowing through. We're actually meeting ASHRAE 241 every minute that the student and the teachers are in the classroom, meaning that we have enough CFM to cover, even if there's an emergency, it's all covered. To take a little step back, most people are not aware of what ASHRAE 241 is, and I'm not going to go into a lot of detail because we don't have enough time. But ASHRAE 241 was put out about a year and a half ago. It was sent down by the White House to the ASHRAE to say, hey, look, you're the engineers, you're the experts, come up with a standard that in the future reduces the risk of airborne pathogens, right? And so the chair of the ASHRAE committee, William Bonfleth, he went through, in 6 months, they came out with the standard. And the standard written says that during infectious risk management mode, meaning when there's an emergency, someone hits a red button, and your school needs to have at least a certain number of CFM. What I'm saying is our low-cost ventilation system meets that and exceeds that. So there are designs out there that should be able to get all the classrooms in this country up to speed. That's number one. Number two, if you have buildings that already have mechanical ventilation, fantastic. We need to keep improving. So the filters in there need to be upgraded. MERV 10, from a MERV 8 to MERV 13, ideally. Thirdly, let's try to add, if you don't have the capacity to move from a MERV 8 to 13, let's try to add HEPA filters. And I'm not referring to the portable HEPA filters that we put in the corner of a classroom. Those are not effective, and it's the wrong application for a classroom. When you have a HEPA filter in the corner, for example, of the back of a classroom, and there's 25 kids in that classroom, and the kids in the front of the class are sick, where do you think all those airborne pathogens are going through? The 10 or 15 kids on the way to that HEPA filter. It's the wrong application. That HEPA filters, portable HEPA filters, are meant for an office setting or an apartment, a home setting, not a classroom. When I refer to HEPA filters, I'm talking about the ones that are installed in a ceiling or wall mounted. So you're drawing airborne pathogens and particles away from the kids. That's the best thing. So, and the last thing is, the most exciting thing, is these advanced technologies that really fine-tune things. For example, UV in heating and cooling coils. Using UV lights can prevent mold from forming, enabling mold-free coils, cleaning the indoor air, improved airflow for a more efficient system overall. And the last one that I'll mention that we've used out in the field many, many times with proven success is bipolar ionization technology. Not the needle point. This is specifically dielectric barrier discharge bipolar ionization technology. It's the most effective technology that's in the space. When we're talking about doing things that are proactive, right? We want to try to be as proactive as possible, taking particles away, inactivating viruses and bacteria, and breaking down VOCs. We want something that's proactive, not reactive and waiting for it to come and catch it in the filter. The ions that are being produced in a supply duct flow out, go into a classroom, and reduce all the airborne pathogens. And when a lot of times we get a lot of pushback because in this field of ionization, unfortunately, there are a lot of people over embellished, right? And so how we say to differentiate it or vet any type of technology, whether it's ionization or any other type of emerging technology, bring in a third-party engineer to test the air before and after on a variety of variables, right? Not just ion levels, VOCs, formaldehyde, particulates, ozone across the board. And if you have a real technology, if there's a real technology that's really going to perform, they should be able to test it and field test it properly. And you should be able to see the performance right there in front of you from a third-party engineer, not from the same manufacturer or contractor that's doing it. So with that, I would also say, you mentioned what things you should stay away from. Well, anyone who's not willing to give you a third-party verification or do a third-party testing in the classrooms and test pilot in the classroom using a third-party engineer, those are the technologies you don't want to be using. So
it's a great, simple way to put it. There are things to stay away from. And I think that applies with cleaning chemicals as well. And I know that's something that is really important for us at Viking Pure with our Green Seal certification and other third-party verifications that we have. So on that note, Josh, would you kind of share a little bit more about how Viking Pure is helping schools clean and disinfect safely without these harmful chemicals that can cause childhood asthma and other harmful things for kids?
Yes, definitely, Norel. As I mentioned earlier, Viking Pure, we're very much a mission-based company that's been around for about 10 years, well before the pandemic, and our mission's always been the removal of harsh and toxic chemicals from the environment. My background was actually in the medical field, owning and operating a host of different medical facilities, and saw firsthand, unfortunately, the impact that these chemicals could have on our patients, on our facilities, and our environment. So fortunately, we've been able to build a business around the removal of harsh and toxic chemicals. So we have a manufacturing facility in Florida. We produce a commercial grade piece of equipment called an electrolyzed water generator. We have different size machines depending on the size of the school, but the science and the technology is the same. One of these machines will sit on site at a school, hooked up to a water source and electric outlet, and through this patented process, produce two unique liquid solutions: Viking Pure Disinfectant and Viking Pure Cleaner. The amazing part of these solutions is they're both 99.9% water. There's no additives, there's no fragrances, there's no surfactants, stabilizers, or any other chemicals added. So because of that, they're both incredibly safe, and really the safest you could possibly have, but still have that efficacy. They're both independently Green Seal certified. Our disinfectant is EPA registered as a hospital grade disinfectant on list 10. Amazingly, our EPA label says no PP required. Now, obviously, depending in terms of the site in the area that you're cleaning, you're still going to want to protect yourself. But in terms of the chemical causing harm, there's no protections that are needed. Hypoallergenic, approved for all types of surfaces, hard and soft. Because of these incredible safety profile, zero across the safety hazard warning and the Green Seal certification, it allows schools to use them more broadly on more surfaces, more often, use them more during the day, but also in a host of unique manners. So for example, most of our schools are putting bottles of the solutions in each classroom. So they're letting teachers and students use them because they don't need any other protection. They're not worried about them drinking them, spilling them, touching them, spraying them, which allows them to, provide another layer of cleaning and disinfecting beyond what, facility staff is typically doing. Similarly, most of our schools are leaving bottles of our product on their cafeteria tables. They don't have to be locked up. They can be used. This is, every school I go to, I always talk about this as such a great use, because especially with the younger kids, but also the older kids, you see that cafeteria tables or food prep areas are getting sprayed with a chemical. Then students or staff are touching them, then picking up their food, eating it. Those chemicals are then getting, transmitted into their body on their food or through their skin. With the Viking Pure product, it being safe, to touch, to breathe, you eliminate all of those issues. We even had one of our schools right before we installed in upstate New York. They told me, a terrible story how a student, grabbed a spray bottle off of a facility's card and sprayed a teacher, in the face with the chemical, which is, terrible and obviously bad behavior, but caused, an issue for that, teacher. Not that we're advocating spraying our solutions on teachers or students, but there would have been no issue, with the safety profile of our product. One other unique program to talk about in schools. One of our schools in Peter's area in New Rochelle, they've created an after-school program for students with special needs to give them a job and purpose that they're actually going around and cleaning the schools using the Viking Pure cleaner and Viking Pure disinfectant, and something that they would only be able to do with a product that's safe for their skin, for every surface, in case anyone ingested it. So it's really just an incredible illustration of having a safer, sustainable, non-toxic product in the school. You can just use it more widely. The opportunity that our product can be sprayed and air dried without wiping or rinsing after in both food contact areas, in classrooms, in gymnasiums, on wrestling mats, etc., allows it to just be used, more often, which is ultimately going to protect the students and staff and workers more, but also in a more, sustainable manner. And I think, just lastly, with our technology, besides, the safety, everything being consolidated down to 2 products, 1 cleaner, 1 disinfectant. It allows the removal of a lot of solutions. We go to plenty of schools that have 10, 12, 20 different products on their facilities card. Every person's using a different product. Using the Viking Pure machine that sits on site and can produce as much solution as they need daily. It allows for better quality control. You don't have to worry about expiration dates, not wanting to waste money dumping down products that have been opened and expired. You're ensuring that the same quality of solution is being used everywhere. You don't have a bright yellow product in one area and a light yellow in the other because the dilution's different. So, with the Viking Pure technology, you're getting something that is effective, has all the credentials required for a school environment, for both cleaning and disinfecting, something that's incredibly safe for the students, staff, workforce, but also bring a higher level of quality, to the institution. So we're very excited. I personally spend a tremendous amount of time, talking to schools, working with schools, because we're so passionate about, helping in those environments.
For sure. I think the theme of the day today has been there's a lot of work to be done and it can be overwhelming, but there are steps that we can take. And I know that's Viking Pure is doing that as much as that we can in schools. And I know, Peter, with the technologies that you shared, there's definitely things that schools can do in a much more affordable way to create healthier, safer environments. I think we are all set. It doesn't look like we have any questions, but feel free to email us at info@vikingpure.com, and we will be sure to share those around. Beth, Sarah, and Peter, thank you so much for joining Josh and I today. We really appreciate your presence on this panel and taking the time with us. And it's been a good discussion. I think there's a lot to do, but we're making the best progress that we can.
Thank you, Narelle. And thank you, Josh.
Thank you all.
Thanks, guys. Enjoy the rest of your day.
You too. Take care.